Okay, so, we've had some really fascinating listener questions lately about some pretty key organs up there in the abdomen.
Yeah.
I'm talking about the gallbladder, the pancreas, the bile ducts, and,
Right.
this whole area that can just be like the source of so much trouble,
Right.
right?
Yeah.
Discomfort, pain, and
It's a hotbed.
it
It's
is.
a hotbed.
And I think, one of the biggest issues that comes up is that these conditions get confused, right?
Oh, yeah. Yeah, absolutely.
Yeah.
I mean, you hear cholecystitis, you hear cholelithiasis, you hear pancreatitis, and
They all sound
it's all Greek to most people, and they all kind of seem to blend together a little bit. So,
right, exactly.
yeah.
So that's what we're going to try to do in this deep dive today.
Yeah.
We're going to take all the information you gave us in that medical text,
Yeah.
and we're going to really try to extract, like, what is the difference?
Pull it apart.
Yeah, between cholecystitis,
Right.
which is the inflammation of the gallbladder,
Uh-huh.
versus cholelithiasis, which is those gallstones, and then of course pancreatitis, which is,
Totally different organ, but it's all
Absolutely.
related, right? It's
Yeah.
all up in the same neighborhood causing problems.
yeah. So let's dive in. Let's start with cholecystitis.
Oh.
What do we need to know?
Well, with cholecystitis, I think the main point to understand is that it's inflammation of the gallbladder,
Right.
and the cause of that inflammation is usually gallstones.
Okay.
The text actually says something like gallstones blocking the cystic duct, that little tube that comes out of the gallbladder,
Right.
and that blockage is what causes the inflammation. But it's worth pointing out that it's not always gallstones. Sometimes it can be bile stasis, which means the bile isn't flowing properly, or it can be an infection, or rarely
Yeah.
a tumor can actually be the cause of that inflammation.
That's really interesting.
Yeah.
It's not always the stones. It's just
It's not always the stones, but that is the #1 culprit.
yeah. Got it. So then, what are the signs for someone who might think, "Oh my gosh, maybe I have this cholecystitis"?
Yeah, well, the clinical presentation is pretty classic.
Okay.
You're going to have pain, and it's going to be in a very specific location.
Okay.
The right upper quadrant, or what we call the RUQ of the abdomen.
Now UQ.
RUQ, and the text even mentions
Okay.
that the pain is often worse after eating fatty meals.
Well, that makes sense.
Yeah, it makes sense, right? Because the gallbladder's job is to help digest fats.
Right.
So if it's not working properly, that's when you really feel it.
Right. So fatty meals, it's just like
And there's a really specific sign that doctors use to diagnose this, and it's called Murphy's sign.
Murphy's sign.
Okay.
We've ever heard of that?
I've heard of it, but I don't know what it means.
Okay, so basically during the physical exam, the doctor will press on the RUQ and then ask the patient to take a deep breath.
Okay.
And if the patient winces in pain because of that, that's a positive Murphy's sign.
Got it.
Pretty reliable indicator of cholecystitis.
That's amazing. So you can just press in there and have them breathe in, and
That's the trick.
that's so cool.
Yeah.
So pain in that upper right area,
Yeah.
especially after a big old fatty meal.
Yeah.
And then when you press on it, that breathing in makes it worse.
And then the other thing
Uh-huh.
is that you're going to see some other symptoms too,
What else?
like nausea and vomiting. And,
Okay, so like digestive
digestive
upset.
Yeah.
Okay.
And very often you're going to see a fever,
Right.
which of course indicates
See, the body's fighting something.
that there's inflammation going on.
Yeah, that makes sense. Okay.
And in some cases, you can even see jaundice,
Jaundice.
which is that yellowing of the skin and eyes.
Right.
And that happens if the bile duct gets blocked.
Okay.
The bile can't drain properly and it builds up in the bloodstream.
That's really interesting. Okay.
Yeah.
So you've got the pain, you might have the digestive upset, you've got the fever, the body's fighting something.
Right. So how do they figure this out? Like, how is this diagnosed? Like, what are the tools?
So the most common and really the best tool we have for diagnosing cholecystitis is an ultrasound.
Okay.
Ultrasound is really good at visualizing the gallbladder.
Right.
You can actually see the gallstones
Oh, cool.
if they're there. And importantly, you can see a thickening of the gallbladder wall,
Okay.
which indicates that there's inflammation.
Right.
So that's kind of the hallmark of cholecystitis.
So you can actually see that the
As
wall
we get thicker.
right on the ultrasound.
That's really cool.
Sometimes they'll do a HID scan.
What's that?
Well, an ultrasound is good for looking at the structure,
Okay.
but a HID scan shows us how well the gallbladder is actually functioning.
Got it.
Is it emptying properly?
So it's less about the image
Exactly.
and more about like,
More about the function.
yeah, what's actually going on.
Yeah.
Okay.
They'll also do blood tests.
Okay.
And these blood tests can show us if there's leukocytosis.
Leukocytosis, which is just a fancy way of saying there's an increased number of white blood cells.
Okay.
And that tells us that there's an infection or inflammation going on.
Right.
And if the bile duct is blocked, you might also see elevated liver enzymes in the blood.
Okay, so all of that together kind of gives a clear picture.
It really helps put the pieces of the puzzle together.
Yeah. So what's like the real key takeaway here? What truly distinguishes cholecystitis from some of these other conditions?
Yeah, well, your text really emphasizes this point, and I think
Yeah.
it's the most important one to remember.
Yeah.
The combination of that acute pain in the RUQ after meals,
Right.
especially after those fatty meals,
Yes.
that positive Murphy sign,
Okay.
and then the presence of fever
Oh.
and other signs of inflammation.
Yeah.
That's really what sets it apart.
So if you just have gallstones, that doesn't automatically mean you've got cholecystitis, right?
Exactly. You can have gallstones and be completely asymptomatic,
Wow. Okay.
which we'll talk about more when we get to cholestasis.
Yeah.
But the point here is that cholecystitis is an acute inflammatory process.
Right.
The text specifically mentions that unlike cholelithiasis,
Okay.
cholecystitis is going to have that fever,
Okay.
that leukocytosis, that elevated white blood cell count,
Right.
and that persistent RUQ pain.
Okay, so constant pain.
Right. It's not going to come and go.
Right.
It's going to be there.
Okay, so that's a big one right there, is that
Yeah.
constant pain with the fever.
Yeah, absolutely.
And then just to round it out, how is cholecystitis different from pancreatitis?
So with pancreatitis, the pain is in a different spot.
Okay.
It's more in the epigastric region.
Okay, hold on. Epigastric region, is that?
Yeah, so that's kind of the upper middle part of your abdomen,
Okay.
just below the rib cage.
Okay, so upper middle versus upper, right?
Exactly.
Got it. Okay, that's a good one. So,
Yeah, so that's one way to tell them apart.
okay, let's move on to cholecystitis.
Okay.
So these gallstones, they can just hang out and not cause any problems sometimes.
Yeah. Sometimes they're silent, but boy, when they act up,
Yeah.
it's no fun, so.
No. So what causes these things to form?
Well, basically, it comes down to an imbalance in the stuff that makes up bile.
Okay.
We're talking about cholesterol, bilirubin, bile salts.
Okay.
When these things are out of whack and not in the right proportions,
Yeah.
they can basically crystallize and form these stones.
So they just start sticking together.
Pretty much, yeah. They clump up and harden in the gallbladder.
I know there are risk factors too, right?
Right, yeah, definitely. I mean, you've probably heard that saying,
Yeah.
female fat 40 fertile.
Right. I've heard that.
It's kind of a classic mnemonic.
I feel like I learned that in school.
Yeah, they teach it in med school,
Yes.
but it's a little outdated, to be honest.
Oh, okay.
It's not just those 4 Fs.
Right.
The text actually points out
Okay.
that things like rapid weight loss,
Really?
high cholesterol, and pregnancy
Mm.
can also increase your risk.
Oh, interesting. So it's not just that stereotype.
Right. It's a bigger picture.
Okay, interesting. So then if someone does have these gallstones,
Yeah.
what's that going to look like for them?
Well, here's the thing. A lot of people with gallstones don't have any symptoms at all.
Really?
Yeah, they can be completely asymptomatic.
Wow. So it's like
It's just to hang the time bomb in there.
just hanging out.
Yeah, they're just chilling in the gallbladder.
Wow.
But if they do cause symptoms,
Yeah.
the most common one is something called biliary colic,
Okay.
and that's basically intermittent pain,
So not constant.
not constant. It comes and goes,
Okay.
and it's usually in the RUQ.
So that upper right area again.
Same spot as cholecystitis.
Got it.
And it often happens after eating fatty foods, just like with cholecystitis.
So very similar presentation.
Yeah, the symptoms can be similar,
Right.
but a key difference here, and this is really important,
Okay.
with uncomplicated cholelithiasis,
Okay.
you're not going to have a fever
Right.
or other signs of inflammation. That's a major way to tell it apart from cholecystitis.
So that fever really is a sign of something more serious.
Exactly. The fever is a red flag
Yeah.
that something more is going on.
Got it. So just to reiterate, we've got kind of the same pain area.
Right.
Triggered by the same things.
Fatty foods.
Yeah, but no fever.
No fever.
And the pain comes and goes.
Intermittent pain.
So how do they actually diagnose this?
Well, just like with cholecystitis,
Yep.
ultrasound is our best friend.
Right.
It can show us those gallstones nice and clear.
Okay.
Sometimes, though, the ultrasound might not be conclusive.
Mm-mm.
So in those cases, they might do a CT scan or an MRI.
Okay, so more imaging.
Yeah, to get a better look.
Got it. Okay, so ultrasound's the first line and
Yes.
then maybe CT or MRI.
Right.
Okay, so the million-dollar question, what really distinguishes cholelithiasis from everything else?
It's all about that colicky pain,
Okay.
that intermittent pain in the RUQ.
Got it.
And it's often associated with meals.
Okay.
But here's the kicker. No fever. And a negative Murphy sign.
Okay, so they do that same test.
Yeah, they'll press on the RUQ
Okay.
and have you take a deep breath. And if there's no pain,
Got it.
that's a good sign it's probably just gallstones.
Okay, and that really distinguishes it from cholecystitis, right?
Oh, yeah, absolutely. Your source is very clear on that.
Okay.
Unlike cholecystitis,
Yeah.
cholelithiasis doesn't cause persistent pain
Right.
or fever.
Okay, so just those stones hanging out.
Yeah, they might grumble a little bit
Yeah.
after a cheeseburger,
Right.
but they're not going to cause that full-blown inflammation.
Got it. And then compared to pancreatitis, how does the pain from gallstones differ?
Well, the pain from gallstones is in that RUQ,
Right.
and it usually doesn't radiate to the back.
Okay.
Pancreatitis, on the other hand,
Yeah.
usually causes pain in the epigastric region that does radiate to the back.
Got it. So location is a factor again.
Location, location, location.
And then radiating to the back is kind of a tip off that it might be the pancreas.
Exactly.
Okay, we've talked gallbladder.
What?
We've talked gallstones now. Let's talk pancreas.
Oh, okay.
Let's talk pancreatitis.
Let's do it.
What is going on there?
So pancreatitis is basically inflammation of the pancreas.
Okay.
And the problem is that the pancreatic enzymes,
Okay.
the ones that help us digest our food,
Right.
they get activated prematurely
Okay.
inside the pancreas.
Oh, no.
Yeah. So instead of digesting food in the intestines,
Yeah.
they start digesting the pancreas itself.
Oh, that's not good.
It's not good at all.
It's very painful.
Yeah. So what causes that? What are the things that can trigger that?
So the most common cause of acute pancreatitis in the U.S.
Okay.
is actually gallstones.
Oh, wow.
Yeah, they can block the pancreatic duct,
Okay.
and that can trigger the inflammation.
So those darn gallstones again.
They're troublemakers.
Yeah. Okay. So gallstones are one.
Yeah.
What else?
Alcohol abuse is another big one, especially for chronic pancreatitis,
Okay.
long-term alcohol use.
Can really damage the pancreas.
Got it.
And then there are other things too, like hypertriglyceridemia.
Hypertriglyceridemia.
Yeah, it's a mouthful.
Okay.
But basically it means you've got really high levels of triglycerides,
Okay.
which are a type of fat in the blood.
Got it. So too much fat in the blood can also be a problem.
Yeah, it can mess with the pancreas,
Okay.
and then sometimes trauma to the abdomen,
Oh, wow.
or certain medications can also cause pancreatitis.
So it's kind of like a combination of those blockages
Right.
and then chemical insults to the pancreas
Yeah, you got it.
that can trigger this.
So then what are the signs someone should be aware of?
So pancreatitis is usually pretty severe.
Okay.
The text describes it as intense epigastric pain,
That upper middle area?
right? That upper middle area, and it often radiates to the back.
Oh, okay.
And the pain is usually worse when lying down.
Wow. So that's a really clear one, right? Like,
It is.
if it's worse when you lie down.
That's a pretty good sign that something's up with the pancreas. Wow, that's really good to know.
And there are a couple of other physical signs
Okay.
that your source mentions, Cullen's sign
Okay.
and Gray-Turner's sign.
What are those?
So Cullen's sign is bruising around the belly button,
Oh, wow.
and Gray-Turner's sign is bruising on the flanks.
Flanks. So like the sides?
Yeah, the sides of the abdomen.
Okay.
These signs can indicate hemorrhagic pancreatitis.
Hemorrhagic?
Yeah, which means there's bleeding into the pancreas.
Oh, so that's a bad sign.
Really bad.
It's a more severe form.
Okay, so if you see bruising,
Yeah, especially around the belly button or the sides.
got it. That's a really bad sign.
Get to the hospital.
Yeah.
And then, of course, nausea and vomiting are really common, too.
Right, like with the other ones?
Yeah, your body's just not happy.
Right, yeah. Okay, so then how do they diagnose this one? What are the tests?
So the gold standard for diagnosing pancreatitis
Okay.
is to look for elevated levels of certain enzymes in the blood,
Okay.
specifically amylase and lipase.
Amylase and lipase.
Okay.
And the text actually says that lipase is more specific to pancreatic inflammation than amylase.
Okay.
So that's the one they really pay attention to.
Got it. So they're looking for those enzymes in the blood.
Yeah.
And
They'll also usually do a CT scan.
Right.
And that's because a CT scan can show us the inflammation.
Okay.
And it can even show us if there's necrosis.
Necrosis.
Yeah, which means tissue death.
Oh, wow.
So that's how we know how bad the damage is.
Okay.
Sometimes they'll use an ultrasound too.
Okay.
Especially to look for gallstones
Yeah.
because, as we talked about, those can be a cause of pancreatitis.
Right. Okay. So blood tests for the enzymes and imaging
Exactly.
to really see what's going on in there.
Yeah, those are the main tools.
So what's like the number one thing that would point toward pancreatitis?
I think the most important thing to remember is that combination of really severe epigastric pain
Okay.
that radiates to the back
Right.
and is worse when you lie down.
Right.
That, along with those elevated lipase and amylase levels,
Right.
that's pretty much a slam dunk for pancreatitis.
So those two things together are really...
Yeah, it's a pretty clear picture.
Yeah. Okay. And how does that compare to cholecystitis?
So the pain location is different.
Okay.
Pancreatitis is epigastric.
Right. Upper middle.
Yeah, and it often radiates to the back.
Yeah.
While cholecystitis is RUQ pain.
Right.
And doesn't usually radiate to the back.
Okay, so location and then that radiating pain.
Yeah, that's the key difference.
Okay, and then lastly, pancreatitis versus just having gallstones, like with cholelithiasis.
Yeah, so with pancreatitis, the pain is much more severe.
Okay.
It's constant, and it's often accompanied by nausea and vomiting.
Right.
Whereas with cholelithiasis, it's more that intermittent colicky pain.
Right.
And it's not usually as intense.
Okay, so it's really about the severity and the persistence of the pain.
Exactly. And those other symptoms like nausea and vomiting,
Right.
they tend to be much more pronounced with pancreatitis.
Okay, cool. So we've gone through each of these conditions.
Yeah, we've covered a lot of ground.
We have, and I know it can be confusing.
It can be.
I think you've done a great job of explaining it.
Well, I'm glad you think so.
I do. So to make sure it really sinks in, we got a little summary here based on everything we've talked about.
Okay.
And it highlights the key differences between these three conditions.
Yeah, that's a good idea.
So we're going to look at each one.
Okay.
And we'll talk about the causes.
Okay.
The primary symptoms.
Got it.
The diagnostic test.
Okay.
And then that key thing that makes it different from the other two.
Makes sense.
Okay, so let's start with cholecystitis.
Okay, so cholecystitis, the main causes are gallstones.
Right.
And bile stasis, leading to pain in that RUQ.
Right.
Often with fever and a positive Murphy's sign.
Right.
And it often happens after those fatty meals.
Yeah.
Ultrasound and HID scans are important for diagnosis.
Okay.
And the real clincher is that persistent RUQ pain, combined with a fever and that positive Murphy's sign.
Got it. So that's really the hallmark.
That's the giveaway.
Okay, cool. Now, what about cholelithiasis? Okay, so cholelithiasis.
Yeah.
It's caused by those imbalances in the components of bile.
Right.
The primary symptom, if there is one.
Yeah, because remember, a lot of people don't have symptoms.
Right. That's crazy.
Yeah, it's wild. But when they do have symptoms, it's that colicky pain.
Right. Comes and goes.
Comes and goes in the RUQ.
Right.
Often after meals.
Okay.
But again, many people are asymptomatic.
Right.
Ultrasound is the go-to for diagnosis.
Okay.
And the key thing that sets it apart is that intermittent pain without fever.
Got it.
And without a positive Murphy's sign.
So no fever, no Murphy's sign, just those stones hanging out.
Exactly.
All right. Last but not least, pancreatitis.
Okay, pancreatitis.
What do we got?
So the big culprits here are gallstones and alcohol abuse.
Okay.
And this one's a doozy.
Yeah.
You're going to have severe epigastric pain that radiates to the back.
Yeah.
Along with nausea and vomiting.
Oh, fun.
Not fun at all.
Yeah.
Elevated lipase and amylase levels in the blood.
Okay.
And CT scans are how we diagnose it.
Got it.
And the big takeaway,
yeah,
that severe epigastric pain radiating to the back.
Right.
Plus those sky-high enzyme levels.
Right.
That's pretty much the hallmark of pancreatitis.
Okay, so it really comes down to a few things.
Yeah.
Location of the pain, upper right versus upper middle. The type of pain, is it constant or does it come and go?
Right.
And then the presence or absence of fever.
Yeah.
And those specific signs like Murphy's sign and elevated lipase and amylase.
Exactly. Those are the key pieces of information that help us tell these conditions apart.
So important to know because if you're experiencing this, it can really help you understand and communicate with your doctor
absolutely.
About what might be going on.
Having a good understanding of these distinctions is so important. I mean, if you're having bad abdominal pain, knowing these differences can really help you get the right diagnosis.
Right, and then get the right treatment.
Exactly. It can really guide your treatment plan.
And on that note,
I've
been thinking about this.
Okay.
We've talked so much about, these three conditions.
Yeah.
But they all kind of involve these organs in the upper abdomen.
Right. They're all neighbors.
They are. They're all right there.
Yeah.
And, we talked about diet. We talked about genetics as factors.
Yeah.
But what about other things?
God.
I don't know, like chronic stress, for example.
That's interesting.
Or other inflammatory conditions in the body.
Yeah.
Do those play a role?
That's a really good question.
Yeah. Or like the gut microbiome.
Oh, yeah. The gut microbiome.
That whole world of bacteria.
It's a jungle in there.
It is. And, it seems like it plays a role in everything.
It really does.
So I wonder, how much all of that contributes to these problems in the upper abdomen.
It's all interconnected.
It is. So That's something to think about.
Yeah.
Food for thought.
It is.
Definitely.
All right, thanks so much. This has been another fascinating deep dive,
My pleasure.
and we'll see you next time.
See you then.